Kelly Zor-el here, and today I'm going to be with my fiance, who is behind the camera.
Hello.
That's Allie. Today we're going to be going over my history, my very long, complicated history of HEDS, otherwise known as Ehlers-Danlos Hypermobility.
I have a question already for you.
Sure.
All right, how many different versions of Ehlers-Danlos are there?
I believe currently there are 14 subtypes, but HEDS is the only type now that does not have a sequenced genome for its mutation.
And you're part of that, aren't you?
Yes, I am. I am one out of the 1,000 people that was picked for the Ehlers-Danlos Hypermobility study that's being done across the world right now. They're hoping to find my mutation specifically so that we can come up with some more ways to kind of deal with the problems at hand, because it's a very weird illness and it's a big umbrella.
Yeah, sounds like it. So on your whiteboard here, you start at 7. So let's start at 7. What caused you to know that you had a bad knee by 7? Because that's like really young to start experiencing things like that.
So I think around 7, what happened is actually I was running a gym and my knee really hurt. And so I came home and I remember, because my dad worked at the Lehigh Valley Hospital at the time, we just went straight over to their pharmacy and I got fitted for my very first knee brace.
So you first braced by 7, that's crazy.
Yeah, it wasn't great.
Yeah. Now, I see at the top there, you're talking about school. Is that already by 7 as well, or is that a little bit later on?
I think that was later on.
Okay.
Just a little bit, probably around 13 or so. So when it began.
So let's get back to that in a minute. You want to go to the next chapter there?
So if you follow my Instagram, you know that my dad passed away. He took his own life when I was 11. It's not been great, but I do want to spread awareness, suicide awareness, because it's a very important thing, and growing up without a parent is a very big deal. So I guess I just want to introduce myself to that community as well.
Yeah, that makes sense. And I would assume that, well, first of all, I would assume that losing a parent at that age would be horrible in any situation, but do you feel like Ehlers-Danlos, like living with Ehlers-Danlos, has been worse with only having one parent?
I think so. I think that maybe if both my parents were here to cooperate with each other on taking me to different appointments and things such as that, maybe it would be a little easier on us. Financially, it would probably be better as well.
That makes sense, yeah.
The hospital bills for having EDS is just like insane. It's insane.
It's insane.
It shouldn't even be a problem.
Alright, let's move on to 12 years old here.
So that's when my heart problems first started. So that's when I was diagnosed at the Children's Hospital of Pennsylvania with a mitral valve prolapse. And I started to have a really high heart rate for some reason. And by high heart rate, I mean, back then it was going to about maybe 120.
Wow.
That was slow back then for me.
Yeah. So now I met you when you were 19, right? Yeah, 19. Okay. So I know that we've talked about POTS, which for everybody else, if you want to just say what that means, because it's a big word there.
POTS is postural orthostatic tachycardia syndrome, and for me, I know this because I have been almost diagnosed with it about 5 times now. I've seen about 6 different cardiologists between CHOP and Penn's doctors. I've even seen another doctor at Jefferson for it, and they can't really explain it, but it's not POTS.
So my question was going to be, when you were 12, did they think at that point it might be POTS, or that was just a high heart rate?
It was just a high heart rate back then.
Okay.
It was really strange. They said that like a 12-year-old shouldn't have a heart rate going that fast. But we didn't really have anything that we could do about it. Meds were a little complicated, and I was so young at that point that they didn't really want to do a procedure of any kind. So we left it at that. The end.
The end.
Unfortunately.
All right. So what's going on at 14 there?
So in between 12 and 16, I have my 14-year gap. which is when I was diagnosed with hypermobility syndrome. That was diagnosed by my sports orthopedist at CHOP. And he basically said because my knees were so unstable and because I had some generalized joint pain and like they came out of place partially, like subluxed, he considered it to be hypermobility syndrome, but not quite at the Ehlers-Danlos point yet.
Now, what's the difference between hypermobility syndrome and hypermobile Ehlers-Danlos?
Well, the way he explained it to my mom and I back then was that hypermobility syndrome is basically EDS, but without the pain and not as frequent of dislocations.
Mm-hmm.
I believe. I'm not entirely positive about that.
But he did diagnose you with it.
Yeah.
Okay. But that's, yeah, then now we know that's not it.
Yeah.
Okay. All right.
It's similar. I have terrible like brain fog today, by the way, which is caused by fibromyalgia. Thank you very much. It's not sponsored though. So I also got diagnosed that year by my rheumatologist with fibromyalgia at the University of Pennsylvania. And then that was also the year that I had started out with migraines as a kid as well.
Mm-hmm.
And this was one of the years that I had like a general scan done of my brain while it was developing, because they just wanted to make sure that nothing was wrong with it. They did find, though, that I had something called right cortical dysplasia. So the right part of my brain kind of formed improperly, but it's not like a severe thing, so it doesn't affect me in any way.
Okay, yeah, that was actually going to be my question. Does it affect you at all? And you just said no. So.
No.
Okay.
It can increase your chance for having seizures, which we might get into later. But right now, I think that's about it for that one.
Okay.
And then, let's see.
The beginning of your first flare.
My first EDS flare definitely started at 16. I had my stomach issues, bowel dysmotility, my mast cell activation disorder issues where I had to go to multiple ERs and I had to use EpiPens like once a week at least for a while there. I was also on steroids, not fun things.
All right, so let's talk about each of these. So bowel dysmotility, what does that mean for people who might not know?
So for those of us with Ehlers-Danlos, you guys are probably familiar with it, but for those who aren't, bowel dysmotility is when part of your colon or like your smaller or larger intestine like doesn't function properly. Mm-hmm. So food might just sit in there and not do anything. So go anywhere.
Yeah, so it prevents you from going to the bathroom properly, right?
Yeah.
Okay.
Basically. And I also don't digest foods very well, and a lot of times I have frequent nausea from it.
Mm-hmm. All right, and then mast cell, what does that mean for people who might not know?
My favorite part, I've seen an allergist for it, and they have no idea what to do about it, and most times, because I have EDS, doctors will just be like, well, it's because of that. Slap that label on, and then, kick me out of the office. The mast cell activation is an allergy response. So basically, your body has natural amounts of histamine, and if you were to get stung by a bee and you were allergic, your body would then kind of like, once you got stung, bring all of the reaction into one area. And what's happening with me is that I didn't get stung by a bee, so I'm not really sure what triggers that. It can be heat, stress, it could be food related, like food allergy related. It can be a number of things. It's a very broad spectrum, and I think that most of mine is caused by heat intolerance, medication, and I would say maybe even stress, just a little bit.
And I'm sorry, I was writing a little note down for later, but did you mention that mast cells, sometimes it's one thing affects you and then later you do it and it doesn't affect you? Is that still true? Right?
So I do have an allergy to lidocaine, which is kind of weird. It's not a super common thing apparently, and I'm only allergic to it sometimes, which is where the mast cell comes in, because it's like my body will react to it in an anaphylactic shock kind of way at certain points, and at other times I can get injected with it and nothing bad happens.
Yeah.
So
it's weird stuff.
Weird.
So how do you deal with mast cell? Do you take any medications for that, or?
So for the longest time, I believe that I was on some type of blocker, so I didn't produce as much histamine.
Mm-hmm.
So that I wouldn't keep like attacking my own body basically with the allergic reactions.
Mm-hmm.
So I also take Benadryl twice a day, which I found out can lead to like dementia. So I'm hoping to change that with an allergist in the future, but that's what I am currently doing to prevent my mast cell from really acting up.
That's a lot of Benadryl.
Yeah, too much.
Yeah, okay. And now, I know for the bowel dysmotility, speaking of medication, I know that you do get that fixed based on the chart there, but we'll get into that when we get there, right?
Yeah.
Okay. So what happens at 18?
18 was my official diagnosis of Ehlers-Danlos Hypermobility by my geneticist, Dr. Stacy Kalish at Penn.
So would you say that when you were 7 is when everything really started acting up, right? With the bad knee?
About.
Okay, so that's, if we take a second to think about this is 11 years since your first, like, thing started happening to you.
Yeah. It's not widely recognized at all, and doctors told me that I was crazy. I had a hard time getting my parents to believe me at some points, and like, that's fine. It's understandable. When you're a little kid and you're complaining about your knee, you know, your parents aren't going to assume that you have some weird disease. They're going to assume like, oh, you probably slept on it funny or pulled a muscle.
So actually, now that you mentioned that your parents sometimes didn't believe you, let's go back to the school and counselors and everything, because we forgot to get back into that.
Oh.
Yeah. So the school took you to court? What does that mean?
My school took me to court. And it was because I had missed so much time in school from being in the hospital and not feeling good in general. Before my official diagnosis at 18 was when I was in school primarily. So they didn't really know like that I was actually sick back then. So they thought that I guess I was just making it all up or being a hypochondriac.
And was it because like you missed so many days, or?
Yeah.
Yeah, okay.
I believe I missed 30 days out of, how many days are in the school year?
I don't know, but
it was
30 is a lot.
It was a lot more than like the average student. My counselors were not friendly. They'd actually make fun of me sometimes. I also had a not so friendly gym teacher who did not believe me whatsoever. He made me run the mile even though I told him that I couldn't breathe or really feel my legs that day.
Yeah, that's crazy.
Yeah. It was rough.
Yeah.
Really, until I got the diagnosis and could tell people like, hey, stop telling me I'm crazy, because I'm not.
Mm-hmm. So what else happened at 18? A whiplash accident?
So my uncle decided to take me go-karting for my birthday. And it was the day I turned 18. My mom was at work that day. I remember that we went in and my uncle wanted them to go faster, these go-karts. So he paid for them to get sped up, but he didn't tell me, and I was already in the middle of racing someone else on the track. So my car just randomly sped up, and I wound up spinning out of control at probably like 40 miles an hour and crashed into a stack of tires in a seat that was way too big for me.
Yeah, you're pretty tiny.
Yeah.
So did anything happen? Like what? Did anything like dislocate or anything like that?
Yeah. So my left collarbone came out and my shoulder as well. Basically, when I did this, it pushed some of my vertebrae in my neck forward and then threw them back, and did the same thing with my shoulder. So I have some vertebrae in my lower neck that are herniated, or like basically like kind of out of place and swollen because of that accident.
Is that something like it'll ever go back into place, or is that?
So my neck will never go into place again, and I've actually been having it become worse over time because I have arthritis in different parts of my body now at 22.
Yeah.
My shoulder wound up going back in. I had to do a excruciating amount of physical therapy and occupational therapy as well.
Yeah,
for learning how to write, and I had to kind of learn how to draw again.
Yeah. Wow. I remember when I met you, you were in physical therapy. Was that because of this when you were 18, or is that still something else?
No, so that's actually, we can get into that.
All right, let's get into it.
But that's at 19.
Mm-hmm.
So that's when I first met you.
Yeah.
And that had been, I think I had only been like a month after my post-recovery.
Yeah, I remember I met you. Well, let's talk about what it was first. Your surgery.
Right. So my knee surgery was patellar reconstruction. I always forget. It's some part of my patella. I don't remember the exact part, which is your kneecap, and they stapled it down in here with almost like a synthetic plastic.
And you're the only person in the world that actually has had the surgery, right?
As far as we know, yeah. It was an experimental surgery.
That's so cool. I mean, like, it sucks that it happened, but it's so cool that you were, like, the first person to really make it happen.
I think so, too.
Yeah, and the doctor, I remember he said that he was trying to get another Ehlers-Danlos patient to have this surgery, too.
Yeah. So it's been 3.5 years now?
Yeah.
Mm-hmm. It's been 3.5 years since I've had that surgery on my knee, and it's been doing so well that they have considered taking in another patient with EDS to do it on them as well.
And they were worried, I believe you said they were worried that you might not walk again, right?
So the surgery came with risks. They had to sever a tendon in there and regraft over it with another sheet of plastic, like tissue almost. It's super small and you actually can't even see it in an x-ray. But they had never done that in anyone before, and over time your body absorbs the cells in the synthetic tissue or whatever you used as a graft, whether it was a person who passed away or not, like a cadaver.
Mm-hmm.
Your body takes that over time, and it all becomes your own tissue. Mm-hmm. So if they were to put regular human tissue in my body, it would have just stretched back out to my elastic version.
Right. Okay, that makes sense. So that's a good reason to pick the plastic.
Yeah.
So I have a couple questions. So the knee that was reconstructed, is that the same knee that was bothering you when you were 7?
It's actually not.
Uh-oh.
So what happened to really jumpstart the knee surgery on my right knee is I tripped on my cat in the middle of the night. He was really fat and hungry. And I didn't want to crush him with my legs, so I hyperextended it like this. I hyperextended it like this. And then I fell over on him, but my kneecap kind of collided with the floor and got shoved up. Ooh. So it stretched out the tendon or something like that.
And but nothing broke, right?
No, but I was taking a shower later and my leg bent in like an L shape almost. Ooh. It wasn't right.
So how long between the time that you tripped on the cat to when it got reconstructed? What was that? Do you think?
That was about a half a year process, I'd say. About 6 months.
That's not that bad. Because I was going to say, I wrote down here, if it was the same knee, that's a 12-year gap between...
I did complain about my left knee for a while to doctors because I didn't have a direct injury. They didn't want to do anything, and they still really won't.
Yeah. So, okay, so let's talk about what I was going to talk about before. When I first met you, you did not have any knee brace on, and...
Did I not?
Well, you maybe had the regular knee brace, but you didn't have the recovery brace. You want to talk about what that was like, the recovery?
So my recovery brace is what we like to call it. My leg was fully extended and it came from my hip down to my ankle, and the entire brace was metal and it locked straight. So I couldn't bend my leg for the first month and a half after I had the surgery.
And then how did you begin bending?
I had a machine that I had to strap my leg into at night and during the day several times that would basically bend my knee in half and crack the scar tissue and everything they sewed back together. It's giving me like agita just like thinking about it. They basically like re-broke it in half. Like that's what it felt like.
Yeah. So,
I'm sure it wasn't, but
well, I see you cringing over here. Was it very painful?
it was a very painful, loud process. Like my knee would make crunching noises and it would freak me out a lot.
Yeah. So yeah, but when I met you, you had only gotten that brace off, like the stick straight one off within a month. And
I just learned how to walk without the brace again.
Yeah.
Because when I had the brace on, you can only walk with using your hip. So if anybody's ever had a knee surgery, that would make sense what I'm talking about. It's confusing, but basically you have to pick up your entire like hip area and move that rather than bending your knee to walk.
Right. Yeah, well, I was going to say, I didn't even know that you had it within like a few weeks of meeting you. Like, I had no idea.
Well, so after my surgery, my physical therapist put me through 3 times a week, every week, physical therapy.
Mm-hmm. Oh, yeah.
For an hour straight.
Wow, yeah. I remember taking you to some of those appointments.
Yeah.
Yeah. All right, so your bowel dysmotility, that was fixed as well when you were 19. So 19 was a pretty good constructive year for you.
Decent, yeah.
So how did they fix your bowel dysmotility?
So for my bowel dysmotility, they gave me something called Trulance, so the dysmotility part of my bowels is in my lower bowel, but the medication I take stimulates my upper bowel. So it doesn't really make sense that it's helping.
But it's helping.
I don't know. I've literally been on, I used to have to drink Miralax every day, something called Smooth Move Tea, which Allie really, had a laugh about the first time I said it. I know it sounds funny, but it was like the only thing that got me through a certain point in my life.
I know, and I've apologized. I'm sorry. It's just, it was a funny word, and when I first met you, I had no idea that you had any of this going on. Like,
Jackpot.
Well, seriously, I didn't know at all. You don't hide it necessarily. Like, you're very open about it.
But I look fine.
Yeah, and that's probably why people are so hesitant to believe you, I guess.
Yeah.
So the dysmotility there, the fixed bowel dysmotility, that was like 3 years between when your stomach issues started to when you got it fixed.
Yeah. Like I was in the ER every other night for on and off between those 3 years.
And did they help you in the ER or?
So they tried to give me enemas and a ton of other things, which I will not get into unless you guys really want me to, but it's a lot of too much info. They tried everything that they could within their hands at the emergency room with me, and nothing helped me have a bowel movement, so.
So lots of nausea, like you said. Did you take anything for nausea?
So I've been on and off stomach, like nausea medications my entire life. Hit a PICC line at one point because I would get so sick to my stomach that I couldn't really eat. And I wasn't intaking enough fluid for my bowels to move properly. So I had a PICC line inserted into my arm and it went up above my heart. And I get infusions through an IV pole weekly or bi-weekly. Sometimes if it was really bad, of just like straight up saline to flush out my system.
Did that help at all?
I think so.
Yeah.
Somewhat, but it really wasn't enough until I started the Trulance for a few months.
Let's go Trulance.
Guess so.
Yeah, so, okay, so 19, pretty constructive year, and then it looks like you had a little break between 19 and 2021.
We got a nice little break there. So Allie and I moved to Florida in that time. We got Nemo, which is, he's out of camera view, but he is underneath you cleaning himself. And it was an eventful year. I had a lot of fun.
Yeah.
And then we moved back here to PA. And what else happened?
Well, then all hell broke loose at 21.
21. Don't ever turn 21. If you have already, congratulations that you've made it this far.
Yeah.
21 was a really bad year for me. So was my 21st birthday. I'm not going to get into that. So when I was 21, I started out with a toothache.
Mm-hmm.
At some point in, like, I think it was June or so.
No, I think it was...
Was it even earlier?
I think it was a little earlier than that. So it was like, and of course, it was when COVID, like, first hit.
So it was like April. So it was like this time.
Yeah, it was like this time last year, pretty much.
This time last year, I started out with having a toothache. I went to a dentist at Temple and had that tooth removed. But X-rays, though.
Before that, right? We had to wait for a ridiculous amount of time because they were like, "Oh, we're gonna wait for COVID to pass," and yeah, here we are, right?
What do you mean?
I'm sorry, I didn't mean to cut you off. I'm just getting angry about it because the whole thing I'm invested in. Go ahead.
It's okay. You're part of the chronic pain community as an ally, so it's fine.
So you had your tooth pulled at Temple.
I had the tooth pulled. In the x-rays of my teeth, they also found out that I had really bad arthritis spreading through the entire, like, right side of my jaw. And it was actually, like, malformed because of it.
So, yeah, so you started out with that tooth pain, right?
Mm-hmm.
You got the tooth pulled, they found the arthritis, and then... So what... Well, no, but what kind of pain were you in at that point? Like how bad was your tooth pain?
So it didn't... I had my tooth pulled, and it still kept hurting, so I didn't really know what was happening, and then they thought that it might have been a cause of the arthritis that they had found.
Yeah, in the TMJ joint?
Yeah.
Is it a joint?
The temporomandibular joint.
Joint, okay. So, and that's where the majority of your pain at the time was stemming from, it kind of felt like.
Yeah.
Yeah, and I remember me and you went to the hospital like at least 3 or 4 times for this, and they were not helpful. Not at all. So
they told me if I had EDS, I didn't belong in an emergency room because it wasn't made for people like me.
Right. Yep.
So.
Yeah. So
moving on from that salt.
Moving on from that, you had your arthroscopy next, right?
Mm-hmm. So it was funny. It was actually the guy's wife, the Temple dentist. His wife works at Penn, and she wound up being my oral maxillo for all of my, like, TMJ needs. So what she did is she went in and cleaned out the arthritis with a little camera, and they made an incision in the side of my face. You can't see anymore, luckily.
Yeah. So they flushed it all out.
They went in there and they flushed out, like, cartilage that was just floating around because the arthritis had, like, eaten it off of the parts of my bone.
Yeah, and she also said, I believe she said that there was, like, a point coming off of the ball joint in your jaw. So
your jaw has, like, these little, like, balls in there, and they're supposed to be ball shaped, but mine over here on the side is, like, kind of lumpy, and I can actually feel it.
Yeah.
Ow.
Yeah, you can.
Yeah, I can feel it, and I can hear it when I open.
Mm-hmm.
So that's a problem that was really never addressed quite yet, but we'll get on to that later as well.
So the arthroscopy, did that help you?
I wish I could say yes. After I woke up from it, I thought I felt better, and the anesthetic was making my face numb, so I came back home really, really hopeful that everything had worked out, and it felt great that day. I woke up the next day, and my face was on fire. It felt like I was being electrocuted from, like, here down into my chin, and it's like I could take a marker and draw down the side of my face that hurts.
Yeah, so more hospital trips, right?
I learned later that this is something called trigeminal neuralgia. It's considered one of the most painful things in the world. It only lasts for a few seconds, typically.
Well,
it didn't in the beginning for me, though.
Right, yeah. I remember you mentioned that, like, first of all, we saw so many different doctors.
I've had, like, 5 doctors with Jefferson for this, and then I had separate ones over at Penn for this.
So what kind of doctors were they for everybody watching?
So I I had like a jaw specialist, to put it basically, which was oral maxillofacial. And then I had the trigeminal neuralgia doctor. And he was also a pain doctor, but he specialized in only face pain.
Right.
And then I had my neurologist from the headache clinic, which is what we're going to be getting into in a few minutes. But he was my main guy over there. I think.
Yeah, so you've had
all of them.
Yeah, I mean, but you've had multiple neurologists and multiple facial pain. Well, oral maxillofacial, yeah, and nobody had an answer for you, really, right?
No.
Yeah. Okay. So worsening migraines, obviously.
I started to have migraines because I was having so much jaw pain. I already was having migraines since I was like a young kid. I think I had mentioned that earlier, but they just continue to get worse after I hit puberty. So around 14 is when they really started to get noticeable for me, and they run heavily in my family as well.
Yeah, so let's talk about the pain and like what symptoms you had from the trigeminal neuralgia real quick. So, I mean, I remember talking about this with doctors, with you, trying to get them to believe you because it's coming from more than one person. Like, I was telling them all the things that I was witnessing, and they were like, well, might not be that, right? I don't really know. And, like, what, do you want to tell everybody what, like, you had vision problems, hearing problems?
So, I still have problems hearing out of my right ear, and I have some facial numbness now that I've had a ton of different treatments on the trigeminal neuralgia, but my face still hurts underneath, so it's like the surface of my face is numb, but the nerves under there aren't. I don't really know how else to explain that.
Well, I remember when we were reading about this, when you first heard about it, it sounds like a lot of people had the same thing happen.
Yeah, I suppose.
With treatment, yeah.
It wound up getting to the point where I was almost passing out, and it would last for like 3 hours at a time, and I would be curling into a ball, sweating and screaming and crying. And there was nothing that could be done. Like, when I would go to the hospital, they'd flood me with pain meds. It didn't make a dent. They tried everything.
Yeah, I mean, you had morphine, dude.
Crazy amount of things.
Yeah.
It was insane.
Yeah.
I've had nerve blocks done. I've had lidocaine. Everything you've tried, I've pretty much tried.
Yeah. And so this is not quite as important, but we did write up there that you started MMJ.
Yeah.
And that was definitely something that we were really researching and trying to figure out like what strains would help you the best.
Yep.
For this particular thing.
So in the midst of all of this, my other family member was suggesting to me that I try medical cannabis, and I thought, I don't really know, that's kind of scary, and like we were both apprehensive, I think.
Yeah, well, I mean, I don't use any of it, but yeah.
I mean, weed isn't something that comes to mind. Well, it wasn't for me for like pain relief until last year. And then my neurologist wound up actually writing me my card so that I could get it legally. So I started going to a dispensary, and I started out with the strains they recommended, which were okay. They were a little heavy hitting, I guess, for someone who had just started out, but they helped incredibly with the trigeminal neuralgia and the migraines. So it helped more than like the morphine and the other things that we had already tried. But it still wasn't enough.
Yeah, it still wasn't enough, but I definitely, like, they gave you something to take home. Like, what pill did they give you? I forget. You had,
the pain meds that I was stuck on for like 2 months because they wouldn't do anything else with my face.
Oxycodone, right?
Yes. They had me on oxycodone for almost 2 months because they were waiting to get me in for the arthroscopy, and they kept taking their time.
Yeah.
And then when the prescription would run out, even though I was taking it only as needed, but it was like my pain was that frequent, so I was taking it every 4 hours as needed. or 6.
I think it was 6, yeah.
Yeah, it was every 4 to 6.
Mm-hmm.
So we did it as directed, and I literally kept like a sheet of notes from the time that I took it to the time that I took it again and again, to prove that like I wasn't overtaking anything, and they still like thought that I was a drug addict.
Yeah, and so you had to use an oxycodone on top of medical marijuana.
Yeah,
and
so
even that sometimes wasn't enough.
Yeah, I wound up getting into medical cannabis RSOs, which is a Rick Simpson oil, and it's typically used in cancer patients for their pain during like the chemo radiation and their nausea. But it wound up actually helping me greatly with this.
Mm. All right, let's get into the next good one here.
Moving on.
No, we're still at 21.
We're not, yeah.
We're still at 21.
Just kidding. So, after, like drowning me in those pain meds, they couldn't really get me off of them without causing my face to be even more aggravated, which is the bad thing about opioids.
Yeah, I was going to say the bad thing about it is that when you take them, they don't really help all that much, and then coming off of them, it
Your
makes the pain even
like,
worse than before you started.
Yeah, it's not great. If you're, just starting out with problems with your EDS, I would recommend avoiding opioids. I know it's really hard with the amount of pain that some of us go through, but they're really, really hard to come off of after trying. Like, I've been on them on and off long term a decent amount of times, like during my knee surgery and during the whiplash accident, and it's just not something that I would like say you should get up every morning and do this as pain management.
No, yeah, definitely not, because you're gonna have to start taking more and more, and
yeah,
and no one's is willing to write it anymore. Mm-hmm. They're all like, oh, you're a drug seeker, blah blah blah.
It makes sense in most ways, other than calling me a drug seeker, which is not really fair.
Yeah, not at all.
Just leave the salt aside. I wanted to say something, but I won't.
Yeah, leave the salt aside. So the what is the next thing that they tried to treat your facial pain with?
Ketamine.
Yay!
I'm just thinking about the trauma that I went through with it. The ketamine trial it's something that they do over at Jefferson. They have a headache center that specializes. They have like a unit for this, and it's for people with chronic migraine and also face pain. So I fit into the criteria, and my facial pain specialist wound up sending me there. But they infused me with this drug for 3 days straight through a midline that I had put in without any lidocaine because I am allergic to it on and off. So they decided, let's not use it on the safe side.
Yep, so they just shoved it in.
You were right there watching it.
Yeah, it was hard to watch.
It was hard to feel.
Yeah. So what is the ketamine used for? Like breakthrough pain, right?
Yeah, but it's also apparently used on like young kids when they get like their shoulder or knee, like a large ligament relocated after an injury, which I didn't know. For
kids without Ehlers-Danlos.
Yeah.
Yeah, so like normal
people. They just give them like a version of this, and it must be like a really tiny amount.
Yeah, it must be.
So it's actually a local anesthetic, for those of you who don't know, and I don't know if they really use it so much anymore for that, but it's also supposed to help with depression. It basically makes you feel like you're out of your body, though, and the disembodiment feeling is anxiety provoking for me. So all they really did was cause me a ton of anxiety the 3 days that I was there. No one could visit me because of COVID.
Well, so, that's not quite true.
You were allowed to come in the daytime.
Yeah, I was there literally from the beginning of the time that you were allowed to have visitors until far past the time that they wanted me to leave, and they had to be like, you literally need to go now.
I don't remember most of the time that I was in the hospital. I remember parts of it, but it feels like it was a really bad nightmare, and I wish it was.
Well,
like a week after, I can't remember either.
Yeah, so can I talk about it for a minute? If you don't really remember, I'll kind of tell you what happened.
Yeah.
Yeah, so when you first got there, they tried to do, first of all, they tried to do some kind of brain scan, right?
Yeah.
And the vibration from the scan
caused my jaw to dislocate.
Yeah,
in the machine.
So we didn't get that scan done right away. So then they put you on the ketamine, and they infused it in the midline, and they only went up a few milligrams at a time, right?
Yeah. So you're supposed to go on this really slowly, but my insurance, the period of time that's covered is anywhere between 3 to 7 days. So you can do it for a full 7 days and go slow, or you could do it faster and try to break through pain if that's your goal within 7 days.
And that was your goal, to break through the pain.
Yeah.
So
which I needed a really high dose for. It was insane.
So she went up pretty high, pretty quick. I mean, like they didn't just like let's do it.
It was like every 3 hours.
Yeah. But they went up pretty slow, like I think 5 or 10 milligrams at a time. Do you remember the maximum amount that you were at?
I think I got up to 120.
That doesn't sound right. I thought it was like 50 or 60.
It was a high dose. I don't really.
Yeah, I don't remember exactly. But yeah, so by the third day, and so the worst part I think for you was when I left at night because you couldn't sleep. You were too anxious.
Yeah. When I was like trying to go to sleep, I didn't feel like I was in my body, and I felt very paranoid and anxious, and the walls were moving at that point, so I just wanted to go home.
Yeah. So she was feeling horrible. And yeah, by the third day, they really needed me to leave at the end of the night, and you were like, I'm literally not staying here. You're like, I'm just not staying here. Take it out of me, I'm leaving. And the doctor was like, can you at least wait until the morning so they can like actually discharge you properly and like give you medication to take home and everything like that? And she's like, no, right? And so the doctor actually allowed me to stay the night that night because he really wanted her to at least get discharged properly. So he did let me stay the night. They took her off the ketamine entirely. And then you don't remember anything after that still?
I remember I was really like having a hard time even after I came home with feeling like spaced out.
Yeah.
And anxious, and it made me feel almost like suicidal, which is like not. I've had that from antidepressants before. Apparently, I have an allergy to serotonin.
Hey.
What are you gonna do about it? I mean, it's fine.
Yeah, so
if you have a serotonin allergy, I wouldn't recommend trying ketamine, basically, in a nutshell.
Yeah. So then, overall, like, do you feel like that treatment actually helped you at all?
So I feel like it didn't make the pain go away. It substituted it. So rather than having this horrible, dull pain that was very, like, pressing and consistent for hours at a time, now it's really fast and sharp, more like trigeminal neuralgia is supposed to be, where it lasts for a few seconds, but it's like, I feel like I'm blinded from the pain, and I like sometimes forget to breathe.
So it took, maybe it like kind of took your migraine pain away, and now it's just the trigeminal neuralgia pain?
They said that it could reroute your neurological pathways somewhat, or form new ones. I don't know how long you'd have to be on it for that. It just felt like I was processing the pain on my face, like throughout my face, a little differently.
I remember the doctor did say that. He said it would make you feel differently about it, and it did, didn't it?
Yeah, it didn't take it away, but it did definitely mute it in some way.
All right, do you want to move on to 22 here?
Are we finally at 22?
Finally at the current age.
Okay. Well, I wish I could say it got better, but it got slightly worse there for a little bit, and then it gets better, hopefully. So at 22, I was still having the headaches, and I had been out of the headache clinic for a little while. We had Thanksgiving, and then Christmas happened, and it was right after Christmas that I still had this feeling of impending doom, which I had had since the tooth pain, to be honest. And I didn't really mention it to any doctors because they already thought that I was kind of crazy and a hypochondriac. right? So why would I bother?
Mm-hmm.
But it really just started to nag at me, and I was starting to get so stressed out that I was having what we thought were seizures. So I went inpatient and I went into a seizure, like an epilepsy monitoring unit.
Mm-hmm.
But beforehand, I had had a brain scan, and on that brain scan, it didn't reveal any damage from any seizures, but it did reveal something called a Pica Aneurysm, which is a, I forget the entire like mouthful of a name that this aneurysm is. Basically, I have an aneurysm in the back of my head, and typically it's supposed to be like a bubble on the top of the vein that forms and would pop over time like a balloon.
Mm-hmm.
But in my case, because of the EDS, my veins are stretchy, so I have a fusiform Pica aneurysm, and it kind of just bows out and then continues to be a normal like vessel again.
You want to draw it on the board there? Yeah, I can toss you a marker. You ready?
Yeah.
Thanks.
All right. So, in a regular aneurysm, it would look like that little balloon right there.
And this is like a vein in your brain, right?
Yeah. So like this. Oh my god, this marker. Also, I'm a left-hander with the whiteboard. It's really hard. That purple part that I just colored in is like the vein. And then over here. Sorry, Nemo. You got your pretty EDS vein of mine, which is, it starts out like this, and then it comes out and then goes back to normal.
Yeah, so it's kind of like more on the inside almost.
Yeah. It's stretched. That's
yeah,
it.
Like they called it like an enlarged vein or something.
Yeah.
Yeah.
So, there's nothing that can really be done about it. If I were to look into treatment right now, it would consist of basically cutting off the vision of my right eye and parts of my movement and feeling on the one side of my body. So we'd like to not do that quite yet.
Yeah.
And it doesn't look like it's going to explode anytime soon. I do have like a pen neurosurgeon monitoring it every 6 months. So it was super anxiety inducing at first because we kind of thought I was going to die. And they were telling me like, don't go on a roller coaster, don't do this, don't do that. And I was like, what if I cough and it blows up and I die?
Yeah, it's scary.
It was terrifying. So I had like 3 different opinions, which I think I did the right thing by doing that. And a lot of people in the online communities with aneurysms had encouraged that just to be safe. And especially with the hesitancy around treating it because of me having the Ehlers-Danlos. I just wanted to make sure it wasn't because of that.
Yeah. So but they also said that this was not causing you any pain.
Yeah, so this was not affecting me whatsoever. We still don't know what is causing the trigeminal neuralgia currently, or the
like the migraine.
The migraines. And then, so I did mention that I went into the epilepsy monitoring unit, and I will bring this up. I got diagnosed with partial non-epileptic seizures, PNES, which are these types of attacks, and it's a seizure in its own way, but it's
like it doesn't cause any brain damage.
It doesn't cause any brain damage. There's no wave that they will detect when you're in the epilepsy monitoring unit for it. It's not brainwave activity that's causing me to like seize up and have my eyes roll back and my body tense. It's kind of just my body's nervous system basically freaking out and reacting to the stress and all of the pain that it's been feeling recently, and like trying to get a hold of it.
Yeah, the best way that I've ever heard it described was actually on the paper that they gave me when I was in the monitoring unit with you, and it said that it's a reaction that you can't control. Like when you're on stage or something and your hand, like your palms get sweaty because you're nervous. Yeah. It's not something that you can control. It just happens. Yeah. So it's like you're not causing it. It's just happening to you, kind of.
Yeah. And I felt like I was going crazy with this, but I talked to their psychologist and their neurologist who was there at the time, and they told me that it's actually a really frequent thing for people who are already diagnosed with seizures to get re-diagnosed with when they check their brainwave activity, because they look so much like a seizure and they do act very similar. I'm still not in control of it, like Ali said, and it's an unfortunate thing. The therapy and treatment for it is going to like dialectical behavioral therapy, which is basically just telling your brain like, this is okay. It's okay to feel this pain. It's okay to process it this way rather than tensing up and causing yourself more harm, which is what we want to teach my body.
Yeah, and definitely one of the biggest things that they said was don't ignore the fact that you feel like you might have a seizure. Like, talk about what's bothering you.
I'm very big on avoiding things or pretending that they're not there, mostly because I'm so used to smiling and walking around every day. But going on behind the scenes, I've been covering it up so much that I guess I didn't process it.
Yeah, I think. And, you know, I've noticed in the past few weeks that you've had significantly less of these episodes. Yeah, I mean, it used to be like... Every night, and sometimes more than once a night. Yeah. And now, like, maybe once a week. Yeah. Mm-hmm. So, definitely can be something that's fixed, you know?
I also got my GED. Well, technically, I did, like, fail the math course, but only because there was a few questions on there that, for some reason, they didn't review in the HiSET book, which is the version of the GED that I took. And I was really upset about that because I had studied for weeks on the math, and then they didn't have like any of the questions that I studied for. So I missed it only by 1 point for passing, and I'm going to be retaking it like this week coming up, and I think I'll do fine. So that's why I'm saying that I got it, because I passed everything else, flying colors, good. Just math is hard.
Math is hard. I know.
And then today, actually, I go for my occipital nerve Botox, which is supposed to help with migraine reduction and hopefully maybe some of my neck pain.
Are you hopeful for that?
I'm hopeful, yeah. Because we thought that I had some cervical instability, but I also had updated x-rays of that, and although my discs are still bulging pretty badly for someone my age, nothing is out of place, so...
So that reminds me, for the Botox, we're going to the same doctor that also gave you nerve blocks, right?
Yeah.
Okay, so what are nerve blocks for people who might not know?
So I had a nerve block done last week. Well, I mean, like, they come in sets, so I'll explain it. So when you go to get a nerve block done, it depends on the area, I'm assuming, because I've had nerve blocks where it was only like 1 to 2 shots. And I've had them done in my hip to numb that area. So basically they're just putting in a small amount of local anesthetic into the nerve that is bothering you. Or if you have like a tense muscle, they'll inject it there. I hope I'm explaining this right.
So is it used for like breakthrough pain?
Or I would say that it's used as management in between the bigger treatments, the more powerful treatments like Botox. Yeah. So they said that I could get it done in the weeks in between because Botox is every 3 months for me in my neck. But the nerve block that I had in my neck was also in my occipital nerves, which run through the back of your head. And I had a set of the nerve blocks done. So in total, it was about 15 needles probably that I had done on me. It's really quick and it's not super painful. I mean, you might have some bruising, but...
And where'd you have them done?
I had 2 sets done here. I had 2 more sets done, like, right below my skull. 1 set on them, 1 set on my scalp. I had them done over here. I had them done here. I feel like I had a few other places on my forehead done.
Yeah, I think you said up here, too, right? Like on your scalp?
Yeah. So... that was a fun endeavor.
But so how long did that, like, help you? Did it help you at all?
So they said that it could last anywhere between like 6 hours to 2 weeks, which is a really weird, like,
big gap.
Yeah, it's a huge gap. But everyone is different with the way they process anesthetic and like how long it takes to get out of their body. For me, when I go under anesthesia and different things, and like even when I get stuff at the dentist for numbing my mouth, I have to have a higher dose than what you would expect for someone my size and height, because of my Ehlers-Danlos. So I don't know if that impacted it in any way, but the numbness effect from the anesthetic only lasted about a day. I think though that it did relax my muscles in the long run for maybe about like 3 more days. So all in all, it wasn't terrible.
Cool. So the Botox is coming up today, and you've had Botox done before in your jaw, right?
I've had Botox done before. I don't think that it was put in the area that I was trying to specify and ask for. So I wound up getting like this part of my neck like partially paralyzed for 3 months. Wasn't great.
And you said it made the pain worse, right? In your face?
Yeah, and I had trouble swallowing and chewing from it.
Yeah.
So we're not going to stick a needle there this time.
Different place. Better results, hopefully.
But yeah, so I think it's a lot between the 7 and 22 over here. But I've really only had 2 big Ehlers-Danlos flares so far, which is surprising because of how much it is. And hopefully there won't be too many more.
How many does the typical person who has Ehlers-Danlos have?
I feel like when my doctors explained it to me and the basic info I read when I first joined groups was that most people weren't even diagnosed until they were in their 30s. Most of them were women. And typically, like, it sounded like the majority of people went through about 2 to 3 really bad EDS flares in their life. So usually like almost every decade or so somebody would have an issue. But for me it's been more like every 2 years.
Well, but if these are your 2 big flares, hopefully we only have 1 more or less, you know? What if you're good after this? That would be awesome.
Maybe. I guess stay tuned to find out.
Whoop.
And let me throw my marker at you.
Hey, you're forgetting something.
What am I forgetting? Oh yeah.
Yeah, the thing that you forgot on 22.
I'm sorry.
Is that
we got engaged.
Yeah, we're engaged. So here I am. Hello.
Did you want to say anything?
I love you.
I love you.
And this has definitely been a journey together. And I'm glad that I'm here. All right, now I'm back over here. Hi, how you doing?
Hey, what's up?
What's up? So yeah, no, I have another question or 2 for you.
Okay.
That we're just gonna end the video with. Sorry for popping in the middle of it, and confusing you.
It's okay.
So you've mentioned multiple times that no one believed you. Doctors didn't believe you. Doctors kept trying to say, like, I want to diagnose you with something else, or no, I don't think it's that, so we're just not going to do anything. How do you deal with those doctors? Tough question, right?
I try to remember that they were trained a certain way, and if I were in their shoes, it would be a lot to like really grasp at the moment, because like a lot of them get very stressed, and I've had some of them be like, I need to get my assistant to make the appointments so I can remember it, and I'm like, how do you think I feel? But I think there needs to be more awareness. I would like to start talking at local schools as well, to provide awareness to especially gym teachers who are pushing kids a little too much physically, and like to get the teachers to not bully kids by accident, because it's been a thing. I've had it happen to me, and going to court because your school thinks that you're not trying hard enough is not really like the greatest answer for a troubled, how old was I when I did that? Probably like 17 or so. I don't think that's what you do to a troubled 17-year-old who is like telling you that there is something wrong and they don't feel okay.
Yeah, I mean,
physically.
Especially at 17, like, you're almost an adult.
Yeah.
Yeah, that's a lot to handle.
Like, I didn't just want to skip school. I wasn't having fun. I was having days where I was feeling so nauseous that I could barely swallow, and headaches so bad that I really couldn't see besides spots, and, like, no one was hearing that.
And that's not right.
Yeah. And the doctors who don't hear it, I try to ease them out of my life. And by that I mean, like, I won't mention any specific names. I've had a hard time with a few doctors in particular, and what I do when another newer doctor asks is I just say that, you know, it was complicated because of the EDS, because it basically really is.
Mm-hmm.
And they take that how they want, and I hope to eventually have a team that completely understands me and listens. Right now, I think I have about 3 really good doctors who don't think I'm crazy, don't gaslight, and they actually do something, like they take action towards my problems rather than just talking about them and being like, oh, that sounds terrible.
But there's
Bye.
something you can do. Yeah.
Yeah.
Yeah. No, I definitely like the most recent person who's giving you the Botox.
Yeah.
She seems good.
She is cool.
Mm-hmm.
So far, so good. So.
Yeah. Is there anything else you wanted to mention, or?
So, as previously mentioned, May is Eds Awareness Month, and I'm also making that video as a contribution to that. So I hope that other EDSers can take a look at this, and maybe some of the younger kids who are getting diagnosed with it won't feel so alone about it, because that's how I felt my entire childhood, and now I know that I'm not, and I have a great community to support me. Where
do you go for your support? Is it like Instagram, Reddit?
So I'm part of the EDS Society, which if you check them out on Instagram or Facebook, it just should be the EDS Society, I think. I'm pretty sure.
Should we link it in the description?
Yeah, we'll link it in the description below. But that helped me. They have like these threads on there where you can kind of comment on previous posted things. I've also been a part of several Reddit groups. I believe I'm part of a Facebook one. And then it's mostly, honestly, on my Instagram that I've had support from other zebras.
Real quick, before we get too far away from it, the Ehlers-Danlos Society website, that one also lists doctors that have helped other Ehlers-Danlos patients. So if you're struggling to find one,
Yeah, you can actually add one of your doctors to the list on the Ehlers-Danlos Society, and they'll review it and approve if that doctor can be accepted. It's basically like if your doctor that you have at home is like a PCP or any type of doctor, it could be a dentist even, as long as they're willing to help with EDS and they're willing to learn about it and like participate in treating patients with it, they can be added to a list of doctors who are part of the network.
So that's really awesome.
Yeah, it is pretty cool. I think I've done it for 2 of my doctors now. I'm working on the second one.
Sweet.
So, yeah. Well, I think that was pretty much everything so far. Not quite 23 yet, but I will let you know at that milestone what happens then. And if you like this video, please share and subscribe, and I will talk to you guys later. Bye.
Say bye, Nemo.
Bye, ma'am.